안녕하십니까. 일산 앞선치과
Hello, I'm
김용진입니다.
Kim Yong-jin from Ilsan Apson Dental Clinic. Last time we looked at on the anterior part how to use OneGuide system for implant placement and also delivering temporary prosthesis. This time we're going to look at how on the upper posterior part the Supracluster Approach, sinus lift and guide surgery, how they can be performed. As you can see on the left case, number 26 is single missing. Then we used to use cast kit. Supracluster Approach sinus surgery can now be done very efficiently with casket by Austin, and I have used and still using this kit very often. But on the upper part, on the right case, if there's a lot of missing tooth or you have to do full mouth implant placement, then the posterior part, the sinus is a bit lowered, and so you have to doing Supracluster Approach and do guided surgery at the same time. What to do? Let me show you what I had done in the past. In the past, OneGuide kit and cast kit was used at the same time. So on the upper part, if I have to place implant multiples, then let me show you how I use OneGuide system for Supracluster Approach. It's male, 70 years old, and there's root red on number 3, and wanted full mouth implant placement on maxilla side. So using guide for placement that will be good. I think in the anterior that is possible, but if it's posterior, the residual bone height, the posterior side is about 4, 5, 6 millimeters. So you need a sinus lifting with Supracluster Approach, and we didn't have OneCAS kit at the same time. So how would I perform guide surgery and did Supracluster Approach sinus lifting? First thing you need to remember is that the shortest drill in OneGuide kit is 6 millimeters. So for this patient, if you use 6 millimeter drill, residual bone height up to sinus floor is, if it's less than 6 millimeters, then penetrate the floor, and the sharp tipped OneGuide drill could tear membrane. And because of that, I changed planning. So this is pre-surgery photo. This is occlusal plane as a lower part, and there is a root rest you can see. So for me, OneGuide drill can be used without tearing the sinus membrane and perforating sinus floor. So I thought about Supracluster Approach. In the library, I said 5.0 by 7 millimeter implant placement. So 7 millimeter drill, if OneGuide drill that is used with not to penetrate the floor, I planned implant placement in Supracluster way. I said the planned implant top to guide top distance 10.5, so it will have high guide hole so that it can act as a stopper. That means the drill tip from sinus floor is about 1 millimeter to the bottom or lower side. So it would have no penetration. Of course, I will not place implant in this way. I changed planning in this way because when using 7 millimeter OneGuide drill, I do not want to penetrate the sinus floor. So after only widen expansion, next step, OneGuide template is removed, and to use cast drill, I planned in this way. In using cast kit, the initial drilling depth needs 1 to 2 millimeters shorter than the from the floor. Then you change the stoppers, so advance, and so that you can fracture the sinus floor. And for that concept to apply, I changed plan in this way. Number 16 is the same. 5 to 7 millimeters implant from sinus floor. It's about the lower side by 1 millimeters. If the plan is changed that way, guide hole will be high, and using the 7 millimeter drill, it will not penetrate the sinus floor. And left side, I also designed in this way. Number 26, about 4 millimeters to the sinus floor, so it's short distance. Of course, implant will not be placed in this plan. While it's expanding or widening, I just made so that the floor will not be penetrated. So in other words, to use casket in number 27, it's how I planned. So on the posterior side, in number 6 and 7, when you drill, the OneGuide template is used so they will not penetrate the sinus floor, but just to do positioning and widening. So when placing implant, the guide can or the template cannot be used. So template is removed and casket is used, and then sinus membrane is hydraulically lifted and grafted, and the implant needs to be placed freehand. In such cases, then prefabricated prosthesis used for immediate loading, that would not be possible. So that was the old method. When the OneGuide system was first introduced, then crystal approach sinus lifting was performed together. So like this guide template is designed, and as you can see, number 6 and 7, guide hole is very high, very long. In other words, this is OneGuide drill acts as a stopper. So all the videos I will not show you. If there's an offline lecture or demo, I will upload all the surgery videos. But as you can see, it's done nicely. Of course, number 16, 17, number 26 and 27, I placed freehand. But with OneGuide system, you do positioning, widening, then the using cast drill, using that path, you can just penetrate the floor, so it's okay. But it's not accurate enough to do prefabrication of the prosthesis. So to remove such inconvenience, we brought together OneGuide system and cast together in OneCAS system. So the casket strength, if you penetrate the floor, minimize the perforation. That strength of cast drill is there, and using the guide hole, you can use the CAS system, and that's all available with OneCAS system. So let me explain how this system can be used. OneCAS kit looks like this. OneGuide template can be used for drilling. So hole sides, there are 2. So OneGuide kit had 2 parts, and here also we have 2 parts. 5.0 is used, and wide hole will be made. So guide barrel diameter will be 5.7, 3.5, 5.0, or 4.0. Implant placement, small size guide hole will be created. Hands through that. Guide barrel diameter will be 5.0 in the drill. So this is lower posterior side. You don't use 3.5 implants. So 4.0, 4.5, you will use normal hole. And 5.0, you will use 5.8 guide hole. So it's in 2 parts. And as you can see, we have initial drill. In OneGuide kit, initial drill had 2-step drill, but here initial drill is 2.2 twist drill. And as you can see, unlike OneGuide kit, there are 2 lengths, 7 and 10. In OneGuide kit, initial drill length was just 1. The maximum drilling depth was about 5.6 or so. But here, there are 7 and 10 millimeter long drill. Why is it so? As you can see, 2.2 diameter, length is 7 and 10. This is because, let me explain. Now, up to sinus floor RBH, if it's more than 7, then you could think just put stopper on 10 millimeter drill, that would be good. But that's not the case. Up to sinus floor RBH, even if it's more than 7 millimeters, then you have to think about guide hole's size. The most important thing is for accurate drilling, the drill's guide barrel and guide hole inside, there should be contact by at least by 2 millimeters. So for this initial contact, you have to start with 7 millimeter drill. The sinus, even if the RBH to the sinus floor is more than 7 millimeters. So this is what I've talked about, the RBH, the residual bone height. If it's more than 7, then you might think 7 millimeter drill will not be necessary. But as you see in the picture, if you start with the 10 millimeter drill, what would happen is the drill part to guide hole, the drill's guide barrel will not come in contact with the inside of the guide hole. So the initial drilling will not happen to the planned or ideal position. That's why you have to start with this short drill 7 millimeter to give some indentation and then move to 10 millimeter drill to have the double contact concept, which is important concept here. And because of that, OneCAS kit has 7 and 10 millimeter 2 drills. And this is very important concept, so I hope that you will remember. Next is OneCAS Drill, and the drilling part is same as the CAS drill. About casket you are familiar, so I'll not explain. It looks like this. In OneGuide drill, 1 to 2 taper drill, it's same with that, so the sharp tip and wide dimension. But in OneCast drill, same as in CAS drill, it has round end design. This means that OneCast drill, it penetrates sinus floor, then round end part conical bone need is formed and sinus membrane is pushed. So the apex part does not come direct contact with the drill. So here, same, you have 7 millimeter drill and 10 millimeter OneCast drill. I told you that for initial 2.22 drill, up to sinus floor bone, remaining bone height, even if it's more than 7 millimeters, you have to start with the 7 millimeter drill so that the between the guide barrel comes into contact of the inside of the guide hole for more accurate drilling. So this is again important point. So when you use OneCAS kit for the first time, you might think that 7 millimeter drill is not necessary if the IBH is more than 7 millimeters. But if you do that, then the guide barrel part and the inside of the guide hole will not come into contact, so it will slip or it will not have accurate drilling. So you have to remember this part. Again, the OneCAS drill is CAS drill, so round end design, and it forms conical bone need. So this is what the OneCAS drill looks like, and has 2 types of length. So drilling sequence and others, same as in CAS drill. So the diameter of the final CAS drill, depending on the diameter of the implant, also the bone, depending on bone quality, it will change, but you can look up the CAS drill for that. Next, let me explain about the stopper, and this is a bit different to CAS drill stopper. Told you that OneCAS drill, same with the CAS drill, but it's not the case for stopper. Let me explain how it's different. This is OneCAS kit's stopper system. From 1 millimeters, we have 9 millimeters. So maximum implant drilling depth will be 10 millimeters. So OneCAS drill, I said, comes in 2 lengths of 7 and 10. But using 10 millimeter without stopper, you can drill up to 10 millimeters. So if the length tension to the sinus floor is more than 10 millimeters, then you don't have to use OneCAS stopper. So stopper system, how it's different? Now here in OneCAS kit, stopper stopper marked number indicate actual stopper length. This means the stopper length of that suggests the drilling length. So 1 means stopper length is 1. So the mark drill from the marked drill number, it will drill 1 millimeter less. So if you put 7 millimeter 1 millimeter stopper, means it will drill up to 6 millimeters because it's 7 minus 1. And if you put 7 millimeters with the 4 millimeter stopper, then you drill up to 3 millimeters. You might think it's very given, but if you're used to CAS kit, it's a bit different. Let me tell you how it's different. When using CAS kit, the sequence of the stopper is by going up in numbers, 2 millimeters, 3 millimeters, and then 4 millimeters. Because CAS kit's stoppers marked numbers indicate actual drilling depth. So if you use that stopper, the depth you drill is the number on the stopper. So 2 millimeter stopper put on the CAS drill, then you drill up to 2 millimeters. So if there's no penetration of the floor, then you go to 3 millimeter stopper. Then you drill 3 millimeters. The stopper number, if it goes up, then the stopper length actually goes down. But in OneCAS system, OneCAS kit's stopper size goes up, the length also goes up. So it's the opposite concept. And that's why in OneCAS kit, the stoppers can be confusing. So you have to actually do the calculation. So if you can use the stopper to 7 or 10 millimeters drill. So how long or depth of the drill is actually indicated like this. 3 millimeter stopper putting to 7 millimeter drill, then the blue numbers. So the blue numbers indicate this stopper, if used with the 7 millimeter drilling depth, will be that blue number. And also red number indicates if you use this stopper to 10 millimeter drill, then this will be the drilling depth. So 3 millimeter stopper to 7 millimeter drill, then 7 minus 3 is 4 millimeters. So this means 4 millimeters will be drilling depth. And if you use this drilling stopper to 10 millimeter drill, then 10 minus 3 is 7. So red number is 7. That is the drilling depth. And that can be a bit confusing. So we'll just emphasize the fact. And about depth gauge, but when it comes to depth gauge, it doesn't come in 2 lengths, just 1 length. It's based on 10 millimeter length drill. And depth gauge, if you mount stopper on that, then the base is 10 millimeter drill. So this depth gauge, if you put 3 millimeter stopper, then the depth gauge protruding area will be about 7 millimeters. So this one is the base again of the 10 millimeter drill in design. So you will need some time to get used to the stopper system. So 3 millimeter stopper to the depth gauge, 7 millimeter will be the protruding area. So depth gauge, there are 2. In CAS kit, there was 1 depth gauge, but in OneCAS kit, there are 2 depth gauges because guide hole 5.0 and 5.8 diameters are different. So the guide hole's barrel diameter is different, and that's why we have 2 depth gauge. Flattening drill. Flattening drill, same. On the upper posterior side, if there's a lot of irregularity, to flatten the area or to smoothen the sharp ridge, you can use this. So it's the same as in the OneGuide kit drill. And you also have tools for hydraulic lifting. And you also have bone carrier, same as in the CAS kit. And this is how it looks. And bone carrier, there are 2 diameters, 3.1 and 3.6. And because of that, after final drilling, depending on drill site, 3.1 diameter tipped bone carrier or 6.6 tipped bone carrier can be used. And about drilling sequence, in other words, how to use it. Now, in digital guide surgery system used for the cluster approach sinus lifting, the benefit is that the accurate maximum RBH can be obtained. You would think sinus floor is flat, but that's not the reality. And the drilling area, what is the RBH in that area, you cannot know. But using this digital guided surgery system, then when you drill through the guide hole, then the guide holds the minimum RBH to the sinus floor and max RBH to the sinus floor can be identified. So based on that information, drilling sequence can be set. Then with the minimum RBH, what do you determine? You can determine initial drilling depth. So initial drilling depth should be 1 millimeter shorter than the minimum remaining or residual bone height. That way, you can prevent accidentally penetrating sinus floor. So 1 millimeter shorter is what you need to remember. Then with the maximum RBH, what can you determine? To penetrate fully the sinus floor for implant placement, you can determine final drilling depth with the maximum RBH. If you only drill up to minimum RBH in the high area, sinus floor is not fully fractured, and if you place implant, the implant apex will touch non-fractured sinus floor and cannot advance. So to fully penetrate sinus floor, the maximum RBH needs to be taken into notice. So it can be used to determine the final drilling depth. So in OneGuide Design Center, if you want to do cluster approach sinus lifting, they give you this information. What is the minimum and maximum RBH? And with that number, using the OneCAS kit, you can determine the drilling sequence. So first, up to sinus floor RBH is 4 millimeters and gingiva height is about 3 millimeters. In such case, what should you do? The first thing, from sinus floor, you have to drill 1 millimeter short. So initial drilling depth, given that residual bone height is 4 millimeter, it needs to be 3 millimeters. Then 7 millimeter drill. To create 3 millimeters depth, you have to use 4 millimeter stopper. If you use 3 millimeter, you go 4 millimeters, so you have to use differently. So it's a bit confusing. So gingiva is thick here, so you often use tissue punch. So you make the entry point, and then with this twist drill, initial drill in OneCAS kit, I told you this is the twist drill is the initial drill, and to create depth of the 3 millimeter stopper is 4 millimeter, not 3 millimeters. And with this stopper, if you drill 7 minus 4, you drill up to 3 millimeters. As in casket, first you only do expansion. The drill hole side is widened, so stopper is fixed. After initial drilling, then using depth gauge, you check whether sinus floor is penetrated. So up to sinus floor, to check penetration, to use depth gauge. Depth gauge again was created based on 10 millimeters. So for depth of 3, 10 minus 7 is what you need to. Again, then means you have to use 7 millimeter stopper. 7 millimeter drill, you need a 4 millimeter stopper to go 3 millimeter in depth. But depth gauge is based on 10 millimeters, so you have to use 7 millimeter stopper to go in 3 millimeters. If there's no full penetration, you have to widen. So OneCAS drill, 7 millimeters, use 4 millimeter stopper, then you go deep by 3 millimeters. So drilling depth, you don't increase, only widen. And 800 RPM would be good. Then this drill and stopper is 4 millimeters. So 3.8 diameter drill, 7 millimeter long drill, and then use 4 millimeter stopper. Then depth will be 3 millimeters, and you only do widening. Your widening is complete. Then to fracture the sinus floor, you have to advance by 1 millimeter. So drilling depth was 3. To change to 4, what you do? 7 plus 3 millimeters stopper needs to be used for advancements to the sinus floor. After that, you check. Then, depth gauge, which stopper to use. 4 millimeter insertion depth is what you need, so use 6 millimeter stopper because 10 minus 6 is 4. So you remove that, and then sinus floor is not fractured. Then what should you do? Then you again advance by 1 millimeters, so you put in 2 millimeter stopper. So 7 minus 2 is 5, means drilling depth is 5 until there's full fracture. You drilled 5 millimeters, so depth gauge, you use 5 millimeter stopper. So without the depth gauge can go in 10 millimeters, so using 5 millimeter stopper, means you can go into the 5 millimeters. So in the clinical setting, you cannot feel the floor that is hard. So once depth gauge touches the guide hole, that means there is a flexure. So depth gauge is 6.6 millimeters longer. So the proving area is by 0.6. So if that fully goes in, the stopper will touch the guide hole, and that is how you check. So fully that the sinus floor has been fractured, then you have to do hydraulic lifting. And for that, the template needs to be removed. And then, like in casket, you prepare the necessary instrument and do the hydraulic lifting. You put in 1.5 cc, 1 cc, and then 1.0 cc up to 2.0 cc. And so gradually you do sinus lifting of the membrane, and if necessary, you do bone grafting. In the carrier, you put in the material and then pack. After that, again, to place implant, you need template. So you place template, and then through the hole, you place the implant. And in this animation, we used 4.5 implant. If the bone is normal, then through the guide hole, using fixture driver, depth control and hex position is done. Depending on initial stability, Healy abutment or the cover cap can be connected. In other words, if there's no guide, then using casket, even if on the panorama or CT, the sinus floor RBH, I did calculation, but in the actual setting, it might be different. Sometimes RBH could be less or more than what you estimated, but using digital guide surgery system and use OneGuide system kit, then in most cases you can be very accurate. And also, implant can therefore placed in the very planned area accurately. This is by Dr. Kim Gi-sung case, and number 26, single implant placement. Of course, this casket could be used, but in the ideal position to place implant there, one casket was used. And as you can see in the digital center, you send your information. Then this minimum RBH and maximum RBH is indicated and given to you. Then, as I said, you have to do initial drilling depth 1 millimeter less than minimum RBH. So you drill by 3 millimeters. That means 7 millimeter drill plus 4 millimeter stopper will be used for depth of 3. Then for final drilling depth, as you can see, 4.88, it's about 5 millimeters. So you drill up to 5 millimeters to penetrate fully the floor. So 7 millimeter drill plus 5 millimeter to go into 5 millimeters. Then you use 2 millimeter stopper. That means you fully penetrate the floor. So through this, OneGuide template is set, and 7 millimeter and twist drill, OneCast drill with the stoppers. That was how it was used. After that, implant was placed. Of course, before placing implant, after penetrating sinus floor, hydraulic lifting and grafting was done, and then implant was placed. Then, healing abutment, sutured. As you can see, exactly as you planned before surgery. And grafting is also done very well. This is a post-surgery panorama, and final prosthesis was delivered at very well placed in ideal position. After final prosthesis was delivered, final CT. The graft material is forming bone well, and the sinus part also looks very good. So like this, crest approach sinus lifting is needed with the guided surgery. Then in the past, I changed my planning so that the guide hole that was high, I made it to work as stopper, but now casket strength is used, and guide hole can also be used for more accurate implant planning and placement with the OneCAS system. So you can do easily the crest approach sinus lifting with the guided surgery. One thing different is first, 7mm, 10mm length exists because sinus floor RBH is 7, but you should start with a 7mm drill for the contact to the guide hole for exact and accurate drilling. And the stopper system is different from the casket system. In OneCAS systems, stopper mark numbers is actual stopper's length. So when you connect the stopper, the drilling depth is something you need to calculate. So lastly, let me share with you two questions that I've received very often. First is, do you have to remove template when doing hydraulic lifting? The template, if it's fixed with the anchor pin, what to do? But still, you have to remove the template. Of course, through the guide hole, if you can do accurate sealing, then you can just leave the template in place. But I think it's very tricky because you cannot know whether it's sealed properly. So remove template to do hydraulic lifting and then put the template again, or put the template again after doing the grafting. Probably in the future, there will be kit developed for hydraulic lifting where you can use with the guided hole. Second, what to do when there is a tear in the sinus membrane. So before surgery, you measure the IBH to the sinus floor, and you can know that number accurately using guide hole. So tear would probability that will go down. To reduce that, probably you do the guided surgery. But if the membrane is thin, there could be perforation, or if the planning is a bit wrong, then there could be tear. Then you have to do repair. Then if there's a tear, crest approach grafting is not done. That is not my principle. So if I have to do surgery, I would use thick and short implant, or lateral approach is used for membrane approach, and then place the implant. But last thing what I want to say to you is that when using OneGuide system, especially if you are going for the OneCast system, then the RBH, minimum max numbers to the sinus floor, is given to you by the center, so you can avoid this. But if you use the wrong stopper, you could have that on your case. So again, remember that stopper is different from casket. In this session, I told you about OneCAS system, how to do crest approach sinus lifting, and along with the guide system on the upper posterior area. In the next session, in OneGuide surgery, how to minimize errors and how to do troubleshooting. Thank you.